Online tools to shop for doctors. Snag on healthcare's complexity. Need a dermatologist? Today, online tools can show you which doctors are in your plan's network as well as rank them by the likely cost of a visit. Still not sure which one to pick? The tools also show whether you have already met your plan's deductible and offer Yelp-like reviews of the doctors. The idea behind these web tools, which have been available from health insurers and startups for several years, is to harness the power of so-called big data. The companies cull medical claims and other sources of information to help people become sophisticated shoppers for medical care, and they promise to curb the overall cost of healthcare in the process. By some estimates, the savings from this newfound transparency could run in the billions of dollars a year. Yet the limits of this data are becoming increasingly clear. Even when people have access to the newly available information, they may not use it. And when they do, they may not rely on the insight. It is impossible to know, for example, whether a dermatologist who costs twice as much as another can more successfully diagnose skin cancer. Price transparency tools are not likely the panacea that many have hoped for with respect to controlling healthcare costs, Dr. Kevin Volpe, the director of the Center for Health Incentives and Behavioral Economics at the Leonard Davis Institute, wrote in an editorial for the Journal of the American Medical Association. The editorial ran with a study of two large employers that found no decrease in outpatient spending as a result of workers' use of online transparency tools. This data's limits are exemplified by Caslight Health, a San Francisco technology company and an early proponent of price transparency. Caslight, which started 8 years ago, ignored the resistance from health insurance companies, hospitals and doctors to make the prices they negotiated available. Caslight told employers it would help their workers make better medical decisions by giving them better information. Continue reading the main story. Related coverage. Opinion taking note. Will people comparison shop for healthcare? May 6, 2016. Why do health costs keep rising? These people know. June 9, 2016. Public health. Yes, Obamacare premiums are going up. June 15, 2016. When it went public in 2014, it earned a valuation of about $3 billion. Today, Caslight's stock has fallen nearly 90% as it has found that changing how people pick doctors and hospitals is much harder than expected. Obtaining prices and other crucial information has proved difficult, and trying to engage employees when they are deciding where to go and what care they need has been daunting for everyone in the industry. And many fewer people are shopping than employers had hoped. Caslight executives insist it's still very early. We overestimated the speed here, said Dr. Giovanni Colella, the company's chief executive and one of its founders. Transparency hasn't even started, he said. Caslight says its tools continue to evolve, and some of its customers say their employees are using the tools to save money on labs or to steer them to certain providers. Caslight executives insist that a huge unmet demand remains. We are many years from the ideal, but the reality is if you're a patient today and going to be prescribed an MRI, the default is a situation where you roll the dice, said John Doyle, Caslight's chief operating officer.